From VOA Learning English, this is the Health Report. Modern medicine mainly uses drugs to cure disease. But what if drugs were replaced with electricity? Pacemakers, small machines that doctors place in the body, already use electric signals to help weak hearts beat regularly. And now, scientists are using electricity on the brain to ease the effects of Parkinson's disease. The disease causes uncontrollable shaking. David Dewsnap has Parkinson's. Medicine did not help him. So doctors operated on his brain. Inside, they placed a medical device called a deep brain stimulation system. The system is made of thin wires that doctors place in an area of the brain that controls movement. The wires are also connected to a battery pack. It produces electric signals. Mr. Dewsnap could not even take a short walk before doctors wired his brain. Now he can. Mr. Dewsnap says the treatment has given him his life back. Caleb Kamiri is an electrical engineer and brain scientist at Rice University. He has been using brain stimulation in his experiments on rats. He says he knows the treatment works, but he does not know how. Mr. Kamiri says the small electric shocks may trick the brain. The shocks copy the work of a brain chemical called dopamine. Dopamine helps control movement or motor activity. Mr. Kamiri wants to develop a brain stimulation system to treat other disorders. The National Science Foundation has given him money for such research. Mr. Kamiri believes there could be experimental devices to help people suffering from other brain disorders within 5 years. For VOA Learning English, I'm Carolyn Persutti.
From VOA Learning English, this is the Health Report. Scientists are working on ways to stop a disease that threatens 1/5 of the world's population. Over 120 million people are infected with lymphatic filariasis, also known as elephantiasis. The disease is found mainly in Southeast Asia and Africa. It affects the lymphatic system, which is a major part of the body's natural defenses for fighting disease. Elephantiasis can cause swelling or enlargement of skin and tissue. The cause is a tiny worm that enters and lives in lymphatic tubes for 6 to 8 years. Scientists say they have been able to demonstrate that the most common cause of elephantiasis can be stopped. They are urging those at risk to sleep under nets treated with chemicals that kill a common insect, the mosquito. Lisa Reimer teaches at the Liverpool School of Tropical Medicine. She formerly served in Papua New Guinea as part of a team studying the disease. The team involved researchers from Papua New Guinea, Britain, Australia, and the United States. Dr. Reimer says she was surprised at how effective anti-malaria bed nets covered with insecticide could be at fighting the disease. Doctors normally use drugs to fight the disease. Lisa Reimer says doctors in Papua New Guinea gave the drugs to people in 5 villages. She says this treatment nearly ended the threat from the worm to humans. But the drugs did not stop the threat from mosquitoes. The treated nets block female mosquitoes from securing blood, which they need to reproduce. The World Health Organization has set a goal of stopping lymphatic filariasis as a public health problem by the year 2020. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Health experts estimate that about 400 million people are infected with hepatitis. Viral hepatitis infections kill nearly 1 million people a year. The majority of cases are in Asia and in African countries south of the Sahara. A vaccine and treatment for some forms of hepatitis are now available, but they can be costly. The World Health Organization says the high cost of drugs is one big problem in fighting hepatitis. Another problem is that most people living with hepatitis do not know they are infected. There are 5 different hepatitis viruses, A, B, C, D, and E. All 5 cause inflammation of the liver. The organ can become large and painful. Hepatitis A and E are spread through infectious waste in food or water. These forms of the disease cause acute infection. However, most people recover. The best way to prevent hepatitis A is by getting a vaccination. But the U.S. Food and Drug Administration has yet to approve a vaccine for hepatitis E. It is usually found in countries with polluted water supplies and poor waste treatment systems. Hepatitis B and hepatitis C can be the most serious. These 2 viruses are responsible for 80% of all liver cancer deaths. You can get hepatitis B from sexual contact or by sharing needles and syringes. They are used to inject drugs. Hepatitis B is common worldwide. The best way to prevent hepatitis B is by getting vaccinated. Hepatitis C is spread mainly through sharing drug needles and syringes. There is no vaccine for hepatitis C. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. Experts are watching the outbreak of a virus in the Middle East for signs that it could spread around the world. David Swerdlow studies the spread of disease across large populations. He is leading the U.S. Centers for Disease Control and Prevention response to the Middle East Respiratory Syndrome, or MERS. Mr. Swerdlow says 30 to 40% of people who got MERS have died. He says infected people pass the virus, which has spread to several countries. There is no treatment or vaccine. MERS is a member of the viral family of germs that cause the common cold and severe acute respiratory syndrome, or SARS. That disease was first reported in China in 2003. It infected thousands of people and killed hundreds before it was contained. Amesh Adalja is with the Infectious Diseases Society of America. He says so far, MERS has not spread as easily as SARS. MERS first appeared in September of 2012. The World Health Organization reports 261 infections and 93 deaths from MERS. Most reported cases have been in Saudi Arabia. In April, there was a sharp rise in cases there. Some health experts fear that means the MERS virus has changed or mutated. But the CDC's David Swerdlow says DNA research suggests there has not been a major change. Scientists still do not know a lot about MERS. They do not even know where it came from, although they suspect camels. On May 2nd, the CDC reported the first case of MERS in the United States. Officials said the patient had been in Saudi Arabia in April. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. For the past 15 years, experts on obesity have gathered in Plymouth, England, to attend a conference. It is estimated that more than half the city's adults are overweight or obese. The rest of Britain is not doing much better. But what is happening in Britain is happening in the U.S., other Western countries, and a growing number of developing nations. Jonathan Pinkney is a professor of endocrinology and diabetes at Plymouth University. Mr. Pinkney said, "Obesity is a long-term problem that is very difficult to solve." He said, "No health issue has more impact on human health than obesity." He called obesity a complex issue involving more than what a person eats. He said politics, biology, and the food industry are part of the issue. Mr. Pinkney said obesity can interfere and impair a person's ability to have a normal life. He warns that even people who are not considered obese can still be at risk. Mr. Pinkney said many people eat the wrong foods and do not get enough physical activity. People have been getting heavier and heavier slowly over time, he said. The professor added that people know how to eat healthy foods, but this knowledge is often overtaken by the marketing of the food industry. Advertisers show food on television and in print in a way that creates immediate desire. The expert argued that the obesity epidemic must be stopped at its source, when eating habits begin. Children, he said, often learn poor eating habits from their parents. Besides marketing campaigns, the professor also blames refined carbohydrates and sugars for much of the obesity epidemic. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Overweight, out of shape, fat. Whatever you want to call it, many studies show that children around the world are becoming less active and less physically fit. The result is an increase in obesity, the condition of being severely overweight. Obesity can result in diabetes and other diseases. Now, experts are investigating if fitness levels affect more than physical health. Could it also affect the test scores of students? A study from the U.S. Centers for Disease Control and Prevention shows that most American children are physically unfit. But children in other countries also face this problem. Health officials across the world are concerned about rising rates of obesity and type 2 diabetes in children as young as 8. This kind of diabetes is directly related to poor diet and lack of physical activity. A U.S. Institute of Medicine study shows that physical activity helps students with their studies. Harold Cole led the study. He is a professor of epidemiology at the University of Texas. He researches how diseases spread among populations. Mr. Cole says there is growing evidence that instances of physical activity help children's brains. He says active children learn and think faster and are more likely to reach their school goals than children who are not physically active. Charles Hillman is a health professor at the University of Illinois. He led a study on physical activity and learning. He said the study showed that kids who had physical activity often improved in school. He also says children learn best if physical activity is included before or during class. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. You wake up early one morning to prepare a meal to take to work, and then you forget it. Has this ever happened to you? Researchers say they now have proof that self-reported minor memory loss sometimes led to greater mental decline 6 years later. They reported the findings at a recent conference organized by the Alzheimer's Association. Rebecca Amarillo is a neuropsychologist at Brigham and Women's Hospital in Boston, Massachusetts. She found that individuals who worried about their memory were more likely to suffer a loss of mental ability. Her research showed such persons were likely to have a protein called beta amyloid in the brain. Beta amyloid is suspected of being at least partly involved in Alzheimer's disease. Evidence that the disease develops for an unknown period of time before doctors recognize it is leading to a new area of study. It is called subjective cognitive decline. It involves people who sense that their memory and thinking skills are failing before others realize it. Experts want to inform the public that most people who worry about their mental decline do not develop dementia, the most common form of Alzheimer's. What they are experiencing is truly natural and normal aging. Dr. Ronald Peterson is a member of the Alzheimer's Association National Board. He says people should be tested if they fear they might have the disease. He says doctors might ask patients about other issues like any medicines they are taking or whether they suffer from anxiety, depression, or stress. He says all those things can cause changes in memory. For VOA Learning English, I'm Alex Villarreal.